Hello friends, today I am going to record various treatment protocols for acupuncturists in the field of SUJOK and others for the fight against COVID-19. Besides working on correspondence system, improved food habits, we need to also work on Triorigin and Six Ki to strengthen immunity as well as for preventive and post-infection treatments. I will share a few slides with you as to how we can take care of our brain, our heart, our lungs, and keep the viral infection at bay. First of all, we must focus on emotional and mental treatment. We must sedate fear, hatred, and jealousy, tonify smile and bliss. And we should also go to the respiratory system. There, we can rent hetero as the mind, and then we can go to the reason, and in reason, we can go to the neutro joint as inspiration and tonify hetero, tonify homo, tonify neutro, and tonify neutro. We can tonify hetero as inspiration for healing, tonify homo as inspiration for better health, tonify neutro and neutro force as spirit of inspiration for healing. Then we need to tonify or sedate the immune organs. First is to go to the immune organs. Then we can reach hetero as thymus in the homo dimension and tonify hetero, sedate homo, tonify neutro. This is to activate and strengthen the thymus functioning in our immune system. Thereafter, we need to sedate tonsils, because tonsils are the first barriers of viral infection in the body, and they get inflamed and they give us warnings by itching, inflammation, difficulty in breathing, difficulty in swelling. Means tonsils need relief. They are in a hetero state and we have to sedate that hetero state. So for that, we go to immune organs. We go to the neutral dimension and rent there. Homo is lymphoid formations. In lymphoid formations, hetero is lymphoid accumulations of nasopharynx. In that, neutro is pharyngeal tonsils, homo is palatine tonsils, and neutro is lingual tonsils. We need to sedate hetero in all these three so as to keep all the barriers, infection barriers in proper shape. How can we do preventive treatment through advanced Triorigin. We can go to immune system. In that we can rent neutro as acquired immunity. Then cellular structure opens. Homo joint is effector cells and hetero is helper cells. In that hetero is T helper 1. We need to tonify hetero, sedate homo, tonify neutro. We have to tonify T helper 1. They will activate cytotoxic T killer cells, dendritic cells, macrophages, because they are the first to respond to any viral infection in the body. Similarly, we go through cellular immunity. Their hetero is T lymphocytes. Again, in their hetero is T helpers. Again, hetero is T helper 1s, and we do heterotonification, homosedation. Now we have to go to the innate immunity, and in that cellular immunity is there, in which local cells are neutro. In that hetero is dendritic cells and homo is tissue macrophages. We need to tonify hetero, sedate homo, tonify neutro. We have to increase their working, functioning, numbers. It is like recharging the army at the border. Then we have to also tonify these dendritic cells and macrophages through adaptive immunity also, which is acquired immunity. We'll go to the heterocellular. Homo is effector cells. Homo is antigen presenting cells, APC, in which hetero is dendritic cells and homo is macrophages. We tonify hetero, sedate homo, and tonify neutro. Respiratory system, preventive treatment through advanced triorigin. We go to the respiratory system, in which alveoli is neutro. We tonify hetero, sedate homo, tonify neutro, and we can also strengthen innate immunity in the whole body. Neutro immune system, neutro is innate immunity. We can simply tone neutro or put a perpendicular to neutro point for leaving it to the body to choose its own protocol. I may add here that when we take antibiotics or antiviral drugs, they are in a fixed dose, 500 mg, 750 mg, 325 mg. But our body is very intelligent. Whenever we'll tone immune system, basically we are giving directions to the immune system in the body to produce as much antibiotic or antiviral drug as is required by the body at that moment of time. If a body needs 849 mg of antiviral, antibacterial drug, it will produce the same amount of antibiotic or antibacterial drug if the treatment is done properly. Now, post-infection, I'm coming now. Most important part is our brain. In the brain, the control center is medulla oblongata, and we need to control inflammation over there, tonify dendritic cells and tissue macrophages over there, tonify cytotoxic T killer cells over there. This treatment, as explained earlier, we have to do. First step, I will again explain that we rent body as functional system, hetero finger is nervous system, neutro joint is central nervous system, in which neutro is brain stem, homo is rhomboid brain, and homo in that is medulla oblongata. When we have done all this renting, now we have reached medulla oblongata. In that, homo are neurons. There's infection, inflammation. So we will sedate hetero, 25 homo, 25 neutro. We have to also work on exit of virus from the blood through advanced triorigin. Body functional system, homo finger, homo joint is circulatory system. Neutro is blood. We come to the neutro finger, in which neutro joint is virus. Hetero point is RNA single stranded virus. Once we do renting over there, we'll reach, now we'll go to the homo joint single stranded plus RNA. All such virus, coronavirus, are single stranded plus RNA. So we'll sedate hetero, 25 homo. We'll sedate hetero, homo, and neutro, and tone neutro, because we'll be sedating mind, body, and life of the virus and making its exit to the zero word. Second is, we go to the circulatory system, rent neutro as blood. In this, hetero is virus as an alien. This is the second option, that now we are going to the virus as an alien. We can sedate hetero as force for spreading, introducing, penetration of the virus. Sedate homo as breeding or accumulating force. Sedate neutro as life of the virus, and 25 neutro. Now we'll go to the respiratory system also. In a respiratory system, hetero is upper respiratory system. Nasopharynx is homo. We can also take the nasopharynx as neutro, in which we'll sedate hetero as virusodiac, tone 25 homo, blocking the virus and it should turn to zero word, 25 neutro, harmonization and protection, and 25 neutro. Now we can also do reduction of virus adhesion to alveoli through advanced triorigin. In this, we need to 25 beta interferons in the immune system. We go to immune system. Homo is cellular immunity. Hetero is non-specific immunity, in which cytokines are neutro. In that, interferons are homo. First group is hetero, in which beta interferons are homo. So we'll 25 hetero, sedate homo, 25 neutro. And we can also 25 cellular immunity or cellular barrier of innate immunity. Once we go to the innate immunity, cellular barrier is hetero. So we 25 hetero, sedate homo, 25 neutro. In this coronavirus disease, alveoli are attacked and the blood loses its capacity to take oxygen. So we have to strengthen the red blood cells also through advanced triorigin. Circulatory system, blood is neutro, but blood is generally in neutro environment. So red blood cells will be hetero. Its outer layer is hetero. So we have to integrity or strength is homo. So we'll 25 hetero, sedate homo, 25 neutro. Second option, second will be when we go to the blood, red blood cells are hetero. In red blood cells, hemoglobin is neutro. Building up resistance or repulsion of virus is hetero process. 25 hetero, sedate homo, 25 neutro. We have to also protect lungs through advanced triorigin. Once we reach lungs in the lungs through layer system, alveoli is neutro, because in this disease, corona disease, they attack alveoli, and the alveoli starts disintegrating. So disintegration is hetero force. So we sedate hetero, 25 homo, 25 neutro, sedate 25 neutro. Sedate hetero, 25 homo, 25 neutro, 25 neutro. Second is that because in our respiratory system, in alveoli also there are different types of cells. Alveoli sites 2 are the biggest attraction magnets for this viral infection, for these viral proteins. So now we have to go from lungs to alveoli neutro. Then we go to the epithelium layer, that is neutro. Alveoli sites 2 are homo. Their disintegration is hetero. We sedate hetero, 25 homo, 25 neutro, 25 neutro. If we find that no, there's a too big scale of inflammation and too big scale of disintegration, then we have to prevent inflammatory cytokine storm. So we reach humoral immunity. Homo is homo, then hetero is non-specific immunity, in which cytokines are neutro. Then we can reach pro-inflammatory cytokines as hetero, homotonification, heterosedation, 25 neutro and 25 neutro. There is 6 key dimensions to cure. We have to eliminate the virus attack. So we sedate hotness of the branch, cold of the main wind energy, both structural and functional type, because there won't be time to see whether the person is a structural type 1 or type 2. So we'll do both on the K and B meridians. Wind on both gallbladder and LI meridian, rent coldness, and in coldness, urinary bladder meridian, we sedate hotness, 25 coldness. And we give the same command on J meridian. Now we have to prevent death of the walls of the alveoli. We'll tone dryness and coldness of the sub-branch, dryness of the branch, hotness of the main energy of dryness. So we rent hotness of dryness. Then in I meridian, we'll rent the dryness as the walls of the alveoli. And then again in lung meridian, we tonify coldness, sedate hotness, tonify dryness, sedate heat. And this will give the command on X meridian. So in this way, we'll work on 6 Ki and Advanced Triorigin to take care of the patients. If anybody is coming to you around just near you, there's no need to fear. First, you have to sedate your own fear. Tonify smile and bliss. Tonify your own immune system. All the preventive steps you have to take. After that, you can work on the patient. Smile thanks to Professor Park, Dr. Natalia, Dr. Ajay Singh, and other mentors, teachers, friends in SUJOK family. Smile thanks.